Diabetes Mellitus and Alzheimer's disease link and risk factors. How to prevent and treat complications and improve life. Written by Sam Dickinson. Read for you by Ashton Haugen. Definition. Diabetes mellitus, or simply diabetes, is a group of diseases characterized by high blood glucose levels that result from defects in the body's ability to produce and/or use insulin. It is a condition primarily defined by the level of hyperglycemia, giving rise to a risk of microvascular damage, retinopathy, nephropathy, and neuropathy. It is associated with reduced life expectancy, significant morbidity due to specific diabetes-related microvascular complications, increased risk of macrovascular complications, ischemic heart disease, stroke, and peripheral vascular disease, and diminished quality of life. Several pathogenic processes are involved in the development of diabetes. These include processes which destroy the beta cells of the pancreas with consequent insulin deficiency, and others that result in resistance to insulin action. The abnormalities of carbohydrate, fat, and protein metabolism are due to deficient action of insulin on targeted tissues resulting from insensitivity or lack of insulin. Diabetes mellitus may present with characteristic symptoms such as thirst, polyuria, blurring of vision, and weight loss. Often symptoms are not severe or may be absent. History. For 2,000 years, diabetes has been recognized as a devastating and deadly disease. In the 1st century AD, a Greek physician, Aristeas, described the destructive nature of the affliction, which he named diabetes, from the Greek word for siphon. Physicians in ancient times, like Aristeas, recognized the symptoms of diabetes but were powerless to treat it effectively. In the 17th century, a London physician, Dr. Thomas Willis, determined whether his patients had diabetes or not by sampling their urine. If it had a sweet taste, he would diagnose them with diabetes mellitus, honeyed diabetes. This method of monitoring blood sugar went largely unchanged until the 20th century. Before the discovery of insulin, little could be done for patients suffering from diabetes. Low-calorie diets prolonged their lives but left them weak and near starvation. But in 1921, doctors in Canada treated patients dying of diabetes with insulin and managed to drop high blood sugars to normal levels. Since then, medical breakthroughs have continued to prolong and ease the life of people with diabetes. In the 50s, it was discovered that there were 2 types of diabetes: insulin-sensitive, type 1, and insulin-insensitive, type 2. 2,000 years have passed since Aristeas spoke of diabetes as the mysterious sickness. It has been a long and arduous process of discovery, as generations of physicians and scientists have added their collective knowledge to finding a cure. It was from this wealth of knowledge that the discovery of insulin emerged in a small laboratory in Canada. Since then, medical innovations have continued to make life easier for people with diabetes. In the 21st century, diabetes researchers continue to pave the road toward a cure. Today, it is unclear what shape the road will take. Perhaps another dramatic discovery like insulin waits around the corner, or possibly researchers will have to be content with the slow grind of progress. Pathophysiology. An understanding of the pathophysiology of diabetes rests upon knowledge of the basics of carbohydrate metabolism and insulin action. Following the consumption of food, carbohydrates are broken down into glucose molecules in the gut. Glucose is absorbed into the bloodstream, elevating blood glucose levels. The rise in glycemia stimulates the secretion of insulin from the beta cells of the pancreas. Insulin is needed by most cells to allow glucose entry. Insulin binds to specific cellular receptors and facilitates the entry of glucose into the cell, which uses glucose for energy. The increased
Sample complete. Ready to continue?